And joining me now to discuss this is Chairman NARD Committee on State Tertiary Health Institutions, Abuja, and that's Dr. Daniel Isoje. Good to have you join us, Dr. Isoje. Dr. Isoje, when you first when you announced the suspension or conditional suspension of your strike sometime this year, rather, I mean July, there was a level of joy that people felt, knowing that, look, the resident doctors are going to resume work. And now we're hearing that you will be resuming that strike all over again. Talk to us about the challenges in terms of implementing this memorandum of understanding between the resident doctors and the federal government.
Okay, thank you very much. Good afternoon, Nigerians. We are considering resumption of the strike because the memorandum of action signed by the federal government have not been met in its entirety. But most importantly, the state of welfare in the state tertiary health institution is even worsening, is more worrisome. Be it as where some efforts are being made at the level of the federal government, but at the level of the state, it's so worse. You will recall that in the past decade, the issue of poor state of welfare in the state tertiary health institution has been a recurring decimal. And as I speak to you now, the situation is worse off. I would quickly just point at some issues. In Abia State, for instance, the resident doctors in Abia State University Teaching Hospital, as we speak now, are being owed 18-month salary. You can imagine what it feels like for a doctor to be owed salary for 18 months. In the society we are, we know the responsibilities that fall on medical doctors. These people, as I speak to you, can't even send their children to school. They can't even cater for their heads and that of their dependents. 18-month salary. I would call attention to a recent happening when a doctor even applied for a visa, for instance, and one of the conditions that led to the build-up to a rejection was the fact that the embassy could not believe that a medical doctor working in government hospital will be owed salary for 4 months. Here we are discussing 18-month salaries arrears being owed our members. The same thing is applicable in Imo State. They are being owed 6 months salary as I speak to you. The same thing in Unimed in Ondo. They are being owed 3 months salaries. And even recently, Kaduna State are also joining the queue, as well as Ekiti State. Now, you expect doctors to give their best. How would they give their best when they don't have salary to take care of their welfare and the welfare of those that depend on them? That is just one of the myriad of issues that we are facing at the level of the state. Now, I would just call attention to the fact that doctors in state and those at federal institutions in training, they both owe the same financial obligation in training. Now, they pay the same exam fees, they go for updates and all that. You will recall that last year, residency training fund was paid for our colleagues, our members in federal institutions. As I speak to you now, no state institution have been able to pay a dime to any resident doctor in the state institutions. Now, this is really unfair, and we believe that we have come to a point where Nigerians should rise to the occasion of calling their state governors to order by ensuring that training as well as healthcare at the level of the state is brought to a standard it should be. Now, not every of our citizens can afford to go to a federal institution. Now, these state institutions help actually to provide healthcare to the people at their doorstep, closer to them. So we are calling on the state governors, especially that of Abia, Imo, Ondo States, as well as Kaduna State and Ekiti. They should address the issue of our members, Daniel, so that our members will not turn beggars.
Quickly, please just allow me to jump in here, because first of all, let me correct when I said you called off your strike 30th of July. We're not even in July yet, so let me correct that. But Now,
Okay.
let's talk about the memorandum of action. You have said that nothing has been met in its entirety, because our understanding when you conditionally suspended the strike earlier was that the government has met a part of your memorandum of action, and some other things that were left will be met, in the coming months. So talk to us about whether anything has been met there, if anything has any of your demands have been met, and then what is actually left, and then the way forward between if there's any option of dialogue going forward.
Okay, thank you. For instance, now the memorandum of action, some of the demands there were proposals on how they're going to be met. For instance, hazard allowance. For instance, there is still discussion on hazard allowance. The meeting that held a few days ago, there was no agreement that was reached. So as we speak now, doctors and health workers are still collecting 5,000 naira as the hazard allowance. The issue of residency training fund, for instance, that also have not been met, though it's been passed. We are told it's been passed in the supplementary budget, but that also have not been met. Then the issue of our members on GIFMIS, those that led to the strike, some of them also have not been paid. Even some house officers, I speak to you now, over 100 house officers also have not been paid. But the attention I'm trying to call the general public to is that as I speak to you now, IMSUT, APSUT is on strike, UNIMED, although is on strike. We want the issue of states also to be addressed, such that even as federal government is addressing these issues, we will not see ourselves in a situation. We will also go into a dispute or industrial actions on account of issues of state, because it's getting worse by the day, and we want the federal government to prevail, as well as well-meaning Nigeria, to prevail on this state government. It's irresponsible for a state governor to owe somebody 18 months salary. There is no business sitting on a seat when you cannot address or live up to your responsibility. How would you expect a doctor to come to work when you are owing 18 months? So I also talked about training, no funding, accreditations. As I speak to you now, no department is accredited in APSUT. How do you train people when there is no accreditation? So these are pertinent issues. So the call is that in as much as federal government is, we are agitating for federal government to address, we are also calling that the state governors, as I mentioned, should also address this issue. APSUT, for instance, is still on 2009 commerce, as I speak to you, and they are not even paying it. How can you imagine salary scale of 2009 you are paying in 2019 and you can't even pay?
Dr. Daniel,
it's not adding up. Now even the COVID-19 hazard allowance that was paid, Daniel, most of the states.
Dr. Daniel, I'm so sorry I have to interrupt you. I can feel your frustration with all of these issues as you speak. And the last thing anyone wants is for resident doctors to go on strike. It takes a toll on everybody. But we hope that you find a way to resolve this issue. Chairman, NARD Committee on State Tertiary Health Institutions, Dr. Isoje Daniel, thanks for talking to us.
Thank you for having me.